My name is Zaid Sadiq. I'm a consultant oral maxillofacial surgeon. I have been a consultant since 2014, having worked at various centres within the UK. I currently work at Queen Victoria Hospital as a consultant oral maxillofacial surgeon. My specialist sub-interest is in head and neck cancer, particularly focusing on mouth cancer and reconstruction. I also cover within my practice activities relating to facial trauma as a result of personal injury. For today's session, I'll be focusing on the diagnosis and management of oral cancer. Oral cancer, or as commonly known mouth cancer, is the 7th most common cancer in the UK. Usually a patient would present with an abnormal area in the mouth, either to their dentist or general medical practitioner. They are then referred to hospital to see a specialist for a biopsy or sampling of the area and further investigation as required. Usually this condition is managed with surgery, but in a small cohort of patients, they may require radiotherapy as additional treatment. Understandably, this complex treatment will have a dramatic impact on the quality of life of patients, affecting them physically and emotionally. I regularly treat patients and receive referrals with regards to mouth cancer. These patients are usually discussed as part of a multidisciplinary approach where treatment plans are put forward. My personal involvement is, as a member of the multidisciplinary team, is to be an advocate for the patient and also plan their surgical treatment prior to their operation, and also looking after them while they're an inpatient. This gives me a unique insight in terms of the medical legal perspective as to how patients are referred from the community and where the pitfalls and the referral pathways and onward management may present. To date, I've been involved with several medical legal cases that mostly focused on delayed diagnosis and its impacts on patient outcomes. Usually, the delayed diagnosis focuses on a missed abnormal area within the mouth or an inappropriate referral to a hospital-based specialties. On the other spectrum, conditions such as oral cancer, because of their nature and complexity, may be subject to mismanagement within the hospital scenario. This could relate to delayed treatment, inappropriate treatment, or substandard patient care while they're an inpatient in hospital. A recent case I've dealt with supplying a report on breach of duty and condition of prognosis for an elderly patient that unfortunately had a delayed diagnosis of oral cancer by their dentist. This was a complex case in that the patient had seen more than one practitioner. Abnormal findings were not managed appropriately and a timely referral was not made. The situation was further complicated by the handling of the referral from the receiving hospital and once again delayed presentation of the patient at the hospital due to clerical errors. Unfortunately, the patient cancer advanced to such a stage that she required a lot more complex treatment, including very complex surgery and reconstruction, as well as radiotherapy. This resulted in a very poor outcome for this patient and extensive suffering.